Have you ever wondered about the silent enemy that is cervical cancer? It's a type of cancer that begins in the cells of the cervix, the lower part of the uterus connecting to the vagina. Picture this: a young woman named Mary. Mary lives a busy life, juggling her career and personal life. One day she notices unusual symptoms: vaginal bleeding after intercourse, heavier and longer menstrual bleeding, and pelvic pain. Concerned, she visits her doctor. After several tests, Mary is diagnosed with cervical cancer. What led to this point in Mary's life? The primary cause of cervical cancer is persistent infection with certain types of human papillomavirus, or HPV. Mary, like many others, was unaware of her infection. It's important to note that cervical cancer is the fourth most common cancer in women globally. The story of cervical cancer doesn't end with Mary. There are two main types of this cancer: squamous cell carcinoma, which develops from cells in the ectocervix, and adenocarcinoma, which develops in the glandular cells of the endocervix. Squamous cell carcinomas account for up to 90% of cases, while adenocarcinomas are less common. Certain risk factors can increase the likelihood of developing cervical cancer. Firstly, long-lasting infection with high-risk types of HPV, such as HPV-16 and HPV-18, causes virtually all cervical cancers. Factors related to sexual history can also increase the risk of exposure to HPV. Additionally, smoking and having a weakened immune system can contribute to the persistence of HPV infections. Other risk factors include having a family history of cervical cancer, exposure to diethylstilbestrol, DS, in the womb, and obesity. But there's hope. Cervical cancer is highly treatable when found early. Mary, after her diagnosis, underwent treatment and is now living a cancer-free life. Prevention is also possible with the HPV vaccine and regular screening tests such as the PAP test. In summary, cervical cancer is a common yet preventable and treatable disease. Its primary cause is persistent infection with certain types of HPV. Symptoms include unusual vaginal bleeding and pelvic pain. The risk of cervical cancer can be reduced by getting vaccinated against HPV, regular screening, not smoking, and maintaining a healthy lifestyle. Remember, knowledge is power. Be proactive about your health and encourage others to do the same.